Iron Deficiency Self-test. The kit includes a test cassette, instructions for use, alcohol wipe, plaster, lancet, buffer solution and capillary dropper. Not included but required is a timer. First, wash your hands with soap and water. To remove the protective cap of the lancet, carefully twist it 360 degrees without pulling it. Use the alcohol wipe to clean the fingertip that will be pricked with the lancet. The side of the ring finger is recommended. Allow to dry and encourage blood flow to your fingertips. Press the lancet down firmly against the side of the fingertip. The lancet will retract automatically after use. Keeping your hand pointing downward, massage from wrist to fingertip to obtain the blood sample. Without squeezing the dropper head, touch the tip of the capillary tube to the blood sample and the blood will automatically enter the tube through capillary action. Make sure you collect enough blood to reach the fill line and take care to avoid air bubbles. If more blood is required, you may need to massage your finger again. Apply a plaster if necessary. Gently squeeze the dropper to apply the blood sample into the sample well marked S. Unscrew the cap of the buffer solution and add 1 drop of the solution into the sample well. Start the timer. Wait for 5 minutes before reading the results. Do not interpret the results after 10 minutes. If you yield an abnormal result or the results present as normal but symptoms persist, then we advise you to consult your GP.